People with developmental disabilities often have considerable other physical health problems too, comorbidities, more than the average person. Family medicine, by its nature, with continuity of care and comprehensive care, patient-centered care, seems like something that would be very useful to provide for people with developmental disabilities. People have to access the healthcare system in advance of becoming sick, and people who have trouble navigating the system might have more difficulty being proactive in that way, and so there's an extra responsibility on behalf of doctors, on behalf of their patients, to be proactive and to make sure that those barriers are reduced. And finally, there's guidelines in Canada for the primary care of adults with developmental disabilities that provide a framework for primary care providers. So in 3 communities in Ontario, we introduced the idea, promoted the idea of developing a program of inviting patients with developmental disabilities in to have an annual or to have a comprehensive health check, a health review. So there are ways to generate a list of patients from electronic medical records, searching, and then having the family doctors and family practice nurses who know their patients well review the lists to come up with a list of people that then could be invited in to have a health check. So in terms of getting people to come in, it is a matter of finding a non-stigmatizing way of expressing to patients the potential benefits of having some extra time with the doctor. We worked with the clerical staff to find ways to do that, and the feedback that we had from patients once they did come in and from their families and caregivers was very positive. There are good tools here in Ontario that were developed to support implementing the guidelines about how to care for people with developmental disabilities. One of the ways we tried to make those resources easily available was to have a template for a health check appointment or form that was annotated in a way that let the physician easily find the resources that they would need. People who work in family practices can benefit from becoming more aware of who it is in their practice has an intellectual disability, so that when that person comes in, they have the perspective and the lens to say, oh, I have to pay attention to different issues than I would for people with other characteristics. Clearly, if we can get young family doctors who are starting out in their careers attuned to the special needs of people with developmental disabilities and the benefits of health checks, then that's going to have payoff over a long period of time. You know, in Canada we have a healthcare system that's built on primary care and in particular on family care providers, and so the more we can get patients and their families to take advantage of good services that we can help family physicians provide, I think that's going to help their health, their access to healthcare services for sure, and I hope their health status as well.